Infection control in field conditions presents unique challenges that can mean the difference between saving lives and losing them. Identifying key risks to implementing life-saving protocols under pressure are essential skills every healthcare provider who works in the field should master. Infection control in field conditions: a comprehensive guide to maintaining safety standards when resources are limited.
Field environments expose us to contamination risks we never face in hospitals. Contaminated water sources are everywhere. Airborne particles from dust and debris. Disease vectors like insects and rodents thrive in these conditions. Overcrowded spaces make person-to-person transmission inevitable. Limited sanitation facilities compound every risk, and contaminated surfaces become breeding grounds for pathogens. Recognizing these risks is your first line of defense, because in the field, multiple threats converge simultaneously, making systematic risk assessment absolutely critical.
Core infection prevention starts with what you have, not what you wish you had. Create hand hygiene stations using available water and soap. Establish clear, clean and dirty zones, even in temporary setups. Segregate waste immediately at the point of generation. Disinfect high-touch surfaces frequently with available solutions. Control patient flow to minimize cross-contamination opportunities. Sterilize reusable equipment between every patient contact. Document every intervention to track potential exposure patterns. Consistency in basic principles prevents major outbreaks. Even when resources are scarce, these fundamentals remain non-negotiable, because prevention is always more effective than treatment.
Personal protective equipment in field conditions requires strategic adaptation. Ensure proper mask fit even with limited supplies. Master single-use glove techniques to maximize limited inventory. Clean and reuse eye protection safely between patients. Implement gown conservation strategies without compromising safety. Follow systematic donning procedures every single time. Doff contaminated PPE without self-contamination. Dispose of used PPE in designated contaminated waste streams. Perform hand hygiene immediately after PPE removal. Monitor PPE inventory to prevent dangerous shortages. Conduct regular compliance checks within your team. Train every team member on proper PPE protocols, because improper PPE use creates false security and real danger.
Early outbreak recognition can prevent catastrophic spread in confined field conditions. Monitor for clustered fever patterns among patients and staff. Document unusual symptom combinations or severity patterns. Track geographic clustering of cases within your operational area. Map symptom onset timelines to identify common exposure sources. Implement immediate isolation protocols for suspected cases. Communicate findings to command structure without delay. Initiate contact tracing for all potentially exposed individuals. Enhance screening measures for all incoming patients and personnel.
Effective infection control requires seamless team coordination under extreme pressure.
Assign specific infection control roles to each team member.
Establish clear communication protocols for infection control breaches.
Cross-train team members on critical infection control procedures.
Implement buddy systems for PPE compliance monitoring.
Conduct thorough infection control handoffs between shifts.
Perform regular quality assurance checks on infection control measures.
Manage team stress to maintain consistent adherence to protocols.
Continuously improve procedures based on field experience.
Because coordinated teams save more lives and stay safer doing it.
Mastering infection control in field conditions requires preparation, vigilance, and teamwork. Identify risks early. Apply prevention principles consistently. Implement PPE and hygiene protocols without compromise. Recognize outbreak signs and respond immediately. Collaborate effectively under pressure to maintain standards. These skills do not just prevent infections, they save lives.